States that continue to lead the case surge: Florida, California and Texas. But several other states across the country are seeing cases rise substantially. And with that, additional pressure on those at the front lines saving lives.
It's extremely busy. So we're full. Our waiting room's full. All our areas are full. We see a lot of patients that are there for COVID-related symptoms or complications. We also have a lot of patients who come in for completely other reasons and are very sick from other pathologies. And so we're dealing with those patients as well. We have had our numbers significantly increase. So we have our standard population who comes in for all the sort of medical and trauma issues that we've always had, in addition to now all our COVID patients. So it's definitely a lot of work. It's a completely different setting than we've had in the past. Every day is a new day.
A new day too for Major League Baseball, with more than a dozen Miami Marlins players and staff testing positive for COVID-19, with Major League Baseball barely getting its much-delayed season underway, now forcing the league's boss to defend their COVID-19 protocols.
I don't put this in the nightmare category. I mean, obviously, we don't want any player to get exposed. It's not a positive thing, but I don't see it as a nightmare. We built the protocols to allow us to continue to play. That's why we have the expanded rosters. That's why we have the pool of additional players. And we think we can keep people safe and continue to play.
And amid a push from the White House for faster reopenings, including schools in the weeks ahead, Google's parent company Alphabet giving its 200,000 employees and contract staff the option to work from home for the next year, despite the optimistic tone from the White House about a V-shaped economic recovery.
If therapeutically we come up with some answers very quickly, which I think we will, then you're going to have a tremendous recovery. Likewise with the vaccines, if you do that by the end of the year, that's ahead of schedule, substantially ahead of schedule, and it's ahead of anything that's ever taken place in terms of vaccines before. So I think if those things happen, if just one of those events happen, you'll go right back into that V, and I think you're probably in the V anyway. I really do believe a lot of the governors should be opening up states that they're not opening, and we'll see what happens with them. But a lot will have to do with the fact that therapeutically, I think you're going to have some great answers. Vaccine-wise, likewise.
And as expectations grow for a safe and effective vaccine, the first phase 3 clinical trial starting Monday in the US in a collaboration between Moderna and the National Institute for Allergy and Infectious Diseases.
We're optimistic, cautiously optimistic, I think is the word others have used, that the vaccine will be successful. The data we published in the New England Journal of Medicine is the basis for that, as well as other data we've seen in challenge models. So we're quite encouraged by the progress. The phase 3 trial is a little bit beyond our control in terms of timing because it's a case-driven study. But presuming that we are able to accrue cases relatively quickly in that study, we would hope in the fall or towards the end of the year we'd have data that we could submit to the FDA.
Just one of several companies in the race to find the immunization formula that could be a bridge to eradicating a virus so broad in its scope and so devastating to so many. Bryce-Pease, SABC News, New York.